Good morning, Jeremy.
Morning, Walt. How are you?
I'm doing well. How are you?
I'm well. I'm well as well.
Got
I
it.
just finished off the heels of 2 weeks of Feldenkrais training in the 4-year program, so I feel comfortable in my body and buzzing in my mind.
Raring to go. Good for you. Yeah, that's good work. Really good work.
Hmm.
So, we kind of hang around with similar circles on social media, don't we?
I
Um,
sure do.
in terms of the performing population, et cetera, et cetera. We kind of this is a very impromptu conversation. I think it originally sort of started by maybe a little bit of friction on the fascial narrative, right?
Mhm.
Yeah, I mean, you want to chat about that?
Yeah, sure.
Yeah.
Sure. Yeah, I think, like my world is not, well, my world is fascial in a way, fascia focused, biotensegrity focused, full body focused,
Yeah.
in the service of the voice. For me, it all comes back to the voice. My yoga teaching is so I can be a better voice teacher, so I can understand movement and body, so I can understand a different kind of education. My Feldenkrais studies, not just because I love being comfortable and I love helping people, but also the nonlinear aspect of the pedagogy. And so I'm like one of those people who I'm just seeking a deeper truth.
Hmm.
And I was also a very tricky student for a number of reasons. One, because I was a cocky little teen who thought, I knew what I needed to know, but also I wasn't understanding the things that I was being asked to do in voice education, things like placement between my eyes, things like back up and over, even things like head voice and chest voice. These aren't feelings that I have. If I pay attention, I do feel there's a slight increase of vibration when I'm lower here or increase of vibration when I'm higher, but it's so slight for me that it just wasn't the way I needed to learn. So when I started teaching, I realized I really knew nothing, and all the studies in voice helped me understand voice inside of a bubble. But I knew that there's something that makes this all make sense because there's a bigger picture that it's within. And so my studies have kept taking me further away from voice, and I'm kind of amazed how it's gone in such interesting directions that I couldn't have predicted. But fascia is a part of that, and when I learned about biotensegrity and fascia on the heels of having a deep dive into biomechanics and in a yoga training, it was like having this side by side comparison of something that was sort of two dimensional and not very resonant, didn't remind me of life, didn't resonate with movement to me. And then biotensegrity and all that came aboard with that, I'm like, well, this is an organism. This is nature. This is patterns that I see outside of myself. This is a way to see myself reflected in nature, and that helps me a tremendous amount. So I'm a big sharing friend, and I have a big mouth, and so
Yeah.
my enthusiasm puts me in some interesting conversations and helps me learn people who have different perspectives, and that's really enriching to me. So I don't really have any bristles up because we have different perspectives. It's kind of exciting to me.
Yeah, yeah. And I think we're being both bald guys, maybe we both have like big mouths in terms of that sharing piece, right? Yeah, no, it's a really interesting progression and kind of a diving into that deeper sense of awareness. That's pretty cool history for you. Yeah. Um, Mine is sort of, I mean, in a way, we're sort of maybe ships passing, possibly, right? Because my immersion was myofascial release, was about the fascial and the tensegrity model. And it's an interesting history for me of learning a work that was well, really quite effective with helping people with pain. And then later on, as I moved kind of I drifted into your shared world here, kind of was helpful for people with voice swallowing, airway issues, etc. And my training was very niche, where it was all about fascia. Um, I didn't have a great idea of manual therapy's mechanism of action back in the early 90s, but it kind of seemed plausible, I guess is a fair word, because I didn't really have a great critical thinking working back then. The work was helpful, which was then rolled back into C. it was all about the fascia because we were doing myofascial release. That post hoc fallacy is so rich in a lot of our shared models that we use. And I'm fine when people don't question or don't doubt or don't sort of pose the hard questions. And because I certainly didn't. It wasn't really until I made the choice to leave that community that I broadened beyond that to say, okay, what about neuro? What about behavioral? What about the psychological influences? How do they influence the interactions that I have with someone when I touch them? And I still have a rather annoying, simple concept that I look from. When I touch somebody, can I choose willfully and selectively one tissue over another, right? I'm touching skin, but anything beyond that is conjecture. Even if we do a joint manipulation or mobilization, we hear that soft resounding pop. How was that mechanism, enforced, if you will? And I think that was probably one of the biggest things that made me question fascia. Not fascia as a structure, as its importance, but I think there's two streets that people are seeing as one almost. Um, Understanding that when we do what's called fascia work, it's helpful for people. But the other one is believing that fascia can get restricted and can change as a result of our touch. And it's the latter one that is really, it's not been proven. We're still working on these theoretical constructs, and whether it's a muscle tension, right? We're breaking muscle tension as if our hands are selective solely to that tension, or as Ben Asher used to talk about the trigger points in here with muscle tension dysphonia, or myofascial release, right? We're all touching in a similar manner, and I know it can come off as, everybody else get off of my lawn unless you're, believing what I do, but that's not really what I believe. I just encourage people to kind of, take those rabbit hole blinders off and just see, much like you have in a way, that there's so many contributors to this work. And whether we choose to present it from a fascial narrative or a behavioral narrative, and, I guess in a lot of ways it doesn't matter.
Yeah. Yeah. It's how you're with the person that you're with and how you suggest things to them and whether the effectiveness of a soft touch over a hard touch is because of fascia's non-Newtonian, non-linear properties or something else. The effectiveness that I've observed of a soft touch over a more aggressive touch in not only the way it increases mobility, but also the way it increases a person's ability to perceive themselves.
Yeah.
Worth whatever label I would put on it.
Yeah.
Like it's just worth so much. It's worth more than the label. It's worth more than anything that could explain it because the purpose of knowing anything about fascia for me is so that I can help somebody get in touch with themselves. And that was such a contrasting kind of theory and science to learn about compared to the narratives we did inherit, like no pain, no gain, and watching people take their jaws and shake their jaws and watching people take their tongue and pull them to increase the resistance while they're trying to reduce the resistance, watching people take knuckles into their jaws and not think to notice that while they're knuckling their jaw, their neck and spine are bracing against their touch,
Yeah.
right? To provide them an alternative to that which we believe in because we've heard it for so long and say, well, why don't we just try out a softer touch and see what it's like? Do a hard knuckly massage on one side of your jaw and then just move the skin around the other side of your jaw. Open and close your mouth and notice there's a difference. And proof is in the pudding.
Yeah.
And I haven't met folks who haven't noticed that difference. And I work with the jaw a lot because I only teach on Zoom. And so it's a really easy thing to help people understand the value of their own soft touch in this kind of interaction. But it really is such a joy to not only feel the proof of concept in my own singing as I have sort of inverted and transformed my own pedagogy around new learnings, which I continually do, and my own voice keeps unfolding, 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 and I'm singing fuller and freer and more clearly than ever before in my life as I get older.
Yeah.
But also getting to observe that in others and empower them to use their own hands, to free their own voice in very gentle, non-invasive ways.
Yeah. Um, I I take that, and we're sharing a lot of similar philosophies. I've expanded, if you will, because I was very, in the beginning, I was very, the touch had to be specific, right? The touch had to be very specific, like in myofascial release. And, it leaned into the more gentle direction. It was often taught as a very gentle intervention, but there was often, to be blunt with you, Jeremy, there was often a mismatch. There was often a mismatch when being treated by, expert, self-described expert or gurus that the touch wasn't always gentle, and there was a real that mismatch really bothered me. That the words coming out of the mouth were much as you described, right? But yet sometimes, oh no, we have to break this stuff up first, and various words. That was troubling for me. That almost that contradiction that was Brenda's. And then, as I moved out, I learned Diane Jacobs' model in terms of kind of respecting skin neurology, skin neurodynamics. And that was a much more gentle touch. So, now I would actually, if you were my patient, Jeremy, I might try and kind of query you as a human being. How aggressive much must touch be to be helpful? Because I believe that when someone walks in my room with a preconceived mindset of he's going to have to bust this crap up, if I don't lean into them a bit, right, and validate their narrative, from a value and perspective, I think we're missing something. Not that I like to be aggressive, I like to be real gentle, but I no longer ascribe that I have the right pressure for you. What I believe in is negotiation, right? Does this feel safe? Does this feel useful? And I think even, when I look back historically at how even the people within the fascia community describe the mechanism of change. I look back at Schlepp's 2003 paper, where he's talking about the various, well, talks about them as fascially embedded mechanoreceptors and how each one could be responsible for some of the changes that we're seeing. I do think there's a small amount of irony that Robert in that little chart that he had when he talked about Ruffini mechanoreceptors, he talks about them being in the fascia, but he omits that they're also in the skin, right? So why might light touch have a neuromodulatory effect on sympathetic dominance? There's an interesting tiny little factoid that if you look at that paper, that Schlepp brings out from older research, that stimulation of, well, in both worlds, skin or fascial embedded Raffinis, right, which respond to a lateral stretch of the skin in a sustained fashion, which is exactly what I do in my ex myofascial release work, has a neuromodulating effect on sympathetic dominance, meaning it causes a relaxation. Now, how cool is that? Without even reverting to fascia being changed, we've got a direct neural channel to the brain that mitigates some of that tone and tension. I guess my point here is not to bowl you over with these little factoids, but what I see is when I hear somebody walk into my room with a very fascially driven narrative, I've I've improved as a human being over the past decade and a half, and I don't totally stomp on that. But it's like, yeah, that's a valid explanation. What you just told me is an unbelievably valid explanation. But you know what? I got a couple more. Would you like to hear them? Because if I can introduce to my patient that it could be fascial, um, only fascial, that limits, I think, potential. But if I say it could be fascial, it could be behavioral, it could be neural, it could be past pat, all these things, it's like, wow, I didn't even think of it in that perspective. That's simply my approach to embracing the wideness of uncertainty versus narrow is the wrong word, but the narrowness um, a single narrative like fascial or muscle or even behavioral.
Yeah, and you know what the best part of this all is it matters in one way, and it really mostly matters to us. It
Mhm.
matters that we understand and we have a narrative that we provide ourselves that lets us feel grounded in some sort of science.
Yep.
But the bigger picture, to me, is that no matter if the touch is hard, the touch is soft, providing a variety of potential touches, a variety of sensory experiences surrounding an intention, like freeing the jaw or whatnot. If we explore, like how you're saying, I have an idea, you have an idea, let's explore these ideas together. We're providing variety to this system that's listening, this system that is self-organizing around variety. And
Yeah.
so it's actually best not to go, this is the right way of doing it, because for our system to discern better from less better,
Yeah.
it needs quantity. For it to get to quality, it needs quantity. And complex adaptive systems need failure, and they need failure for lasting success. So let's explore those knuckles and see how we like it. Let's explore soft touch. What kind of information is there between both? That's useful information. That's novel information. That's information that flows through the senses, not from the mind downwards.
Yeah.
That to me is, the language of the body's learning style, is variety and sensation. So it's going to work it out,
Yeah.
especially if we don't have a stronghold around this is the way it should be.
Yeah. And I think I don't want to say it's unfortunate, but it's quite frequent when patients walk into us with a preconceived notion of what's going on. And I think that's a delicate balance, at least as me as a manual therapist, right? When they come in essentially spouting something that I totally disbelieve. Now, there's a real mismatch there, right? And early on, when I transitioned from MFR to more of a neurocentric approach, I was pretty rigid in saying, no, that's not how the body works. People think that, but that's not it. And I realized that there's something very disconnecting about that and off-putting to patients who, a trusted person, whoever that might be, even Dr. Google, told them that, and it seems to ring true based on everything. So I really have stopped stepping on those stories and you know what? And acknowledge it, Jeremy. It could be your fascia. It could be, sort of a learned pattern that your nervous system hasn't let go of yet. But does this feel useful right now? And that's how I sort of love to turn that around. It could be that, and it also could be this. But right now, in this instance, does this feel like we're connecting to your issue, right? I have a what one of the I've sort of this list, this very short list of research that I point to when I'm sort of introducing the concept of maybe it's not just about the tissues as you, I, and most of us learn. And that's, I like this quote so much that it forms the banner photo on my Facebook page, my not my foundations, but my Walt Fritz PT. And if you don't mind, I'm going to read it to you. Do you mind?
Go ahead.
Clinicians should remember that manual techniques are not tools to fix the patient's body. Rather, they provide the opportunity to communicate with the patient's brain similar to words. And that's by Tommaso Geri in 2019. And to me, it represents, in my view of the body, the most complete sense that we think we're doing all this stuff out in the periphery. The what happens in Vegas stays in Vegas perspective, right? But Jerry and so many other people have really pointed to these multifactorial effects of touch, of manual therapy. And I think, you and I, in terms of moving into the more the pedagogy model, there's so many different models that describe the effects. It's like, well, how are these working? Are they doing the thing out in the periphery? If I change your arches, I'm making something up here. If I give you arch supports because I feel it's not fully supporting your pelvis, right? Is that the mechanism that created a better voice? Or is it the fact that I said, Jeremy, I think your arches might be contributing and you buy into that, not in a negative way, right? But because I'm an expert, that becomes a driver of change, whether or not changing your pelvis and your feet did it. But that sense of empathy and caring and affective, interaction, I think that's a huge part of what all of us do for a living that often goes underplayed.
I try to keep my hands off in a way. I really try to keep my hands off of diagnosing or trying to figure out what the problem is. I hear a student saying, and I hear it and feel it in my body, and I intuit in some way where I sense stuckness, and I could be completely wrong, but it gives me somewhere to start. And but really, that information stays here. And after my client sings, I ask them, the things that they felt and they thought, and sometimes we disagree very much, but it's their experience, and I'm nurturing their experience and their knowing. And at the end of the day, we're working with somebody's mental model. And so, like you said, you have to respect that and have compassion for what they believe in. And it does nobody any favors to say, you're actually wrong about that.
Yeah.
Not helpful.
Yeah.
Not very helpful at all. I am biting my tongue a lot with clients who have beliefs that many people have, and maybe I'm wrong, who knows? But the belief usually provides an opportunity to explore something,
Yeah.
and deeper meaning will emerge. And this is what I work with help teachers with in my community body-based voice ped is, like, let's work with the mental model and let's see how we can fill it up a little bit, fill in some blanks, and make it a little bit more holistic as we let the body be a dynamic process and show us a lot about what we're trying to do by the things that we explore with it. And the proof is in the singing. The proof is in, did the singing get freer? Was that higher note less strenuous? Was that vowel more similar to the other vowels? Whatever intention we have in whatever moment is really, like, how does this flow and how does this affect you? How is this valuable for you? And what would you like to do with this kind of tool, this toy? We actually kind of stopped saying tools. And instead we think of each strategy like a toy that came without instructions. And so you're just like holding on to this idea and going like, how does this thing work? Like, I got my fingers, I got my jaw. What could I do here? And start to play. And it really opens up all the channels of neuroplasticity. And learning is organic, just like we learned to stand up. Should we be able-bodied enough to stand? And how we learned to mess around with our mouths until we were able to talk. And it was a joyous, playful, long time journey to all these skills that stick around through our lives. And we develop little issues in these skills sometimes, some people, and then we can optimize the system and restore and regain and optimize the outcomes. But I think at the end of the day, it's the person in front of you, and whether they're saying things that are correct or incorrect, that is a reflection of your mental model and what you believe is correct and incorrect. And I hold a lot of space for a bigger possibility of whatever correct is. And I also fully intend on never getting there.
Yeah.
I'll never know the truth. I'll never understand the body. I'll never understand the brain. I'll never understand what learning truly is. But I can get closer. I can try to find a bigger picture, a deeper integration, a more holistic point.
There's a saying that some of my online friends frequently use, and there's not necessarily a right answer, but there's some that are less wrong. And
Yeah.
I think moving towards less wrong is often an admission that, you know what, the more I learn, I'm not sure whether I'll ever find the one answer, but that's probably more representative of the actual human beings that we work with, right? Yeah.
Mm.
This touch versus non-touch. So my work as a physical therapist, teaching this work to others, it means in the United States, licensed health professionals. And, voice coaches in the United States are often excluded from that concept of using manual therapy. But there's also, I think, within your community of voice teachers, coaches, and I'm sorry, I don't know exactly how you describe yourself, but there's that some people do use simple touch with permission, appropriate, where get your shoulders back, whatever. I like to talk about this a little bit in each of my classes, where if you were allowed, for instance, Jeremy, or saw yourselves as capable through Zoom, reaching through the screen, right, of reaching out to your person because you see that they're doing this, and you think that's a contributor, right? A voice coach, in the right circumstances, might feel that's within their qualifications to do this, right? Get your chin back, touch-based cueing, and that's somehow viewed as a behavioral cue, right? An awareness cue. Whereas if I saw a patient and I'm allowed to touch, I'm allowed to stretch, I'm allowed to massage or whatever, I might come in and instead of just doing a quick boop, I might do, okay, let's get your chin back and let's hold it for X number of seconds or minutes under the thought that I'm reorganizing structure, changing tissue mechanics, all those sort of manual therapy beliefs, right? That often changes the person's head posture too, right? One person used the behavioral cue, another person did what they thought was manual therapy. And those are often viewed with a pretty firm wall between them. They're very different mechanisms. But when you really start to unpack a lot of the new evidence for not just manual therapy, but touch, psychological qualities of touch, I believe you'll find a lot more crossover between those two, that possibly even with that quick touch-based cueing, you might be setting in place a mechanism that's not that dissimilar to what I do when I hold it, thinking I'm releasing fascia or whatever, right? But if because you're using Zoom or philosophically, you don't use touch, I mean, that is certainly, not something that I'm encouraging or say has to be done. I just think when we start getting rid of all those preconceived notions, maybe touch is touch no matter how we how we dose it. It's like non-denominational, that it's all reaching that sense of right up here in our clients, right?
You're reminding me of like how there's the Tai Chi maxim, as above, so below. You know, there's such a balance and there's such a scalability to the work. The science of neuroplasticity talks about how when we're on a path for a duration towards an outcome, we prepare the channels of neuroplasticity, and the change doesn't happen until we're in deep sleep or non-sleep rest, or deep non-sleep deep rest, right? Like meditation. This is sort of filtering through the Andrew Huberman lens. So maybe there's more to that, but my point is, we do something for a long time to learn about something, improve about something, and then it doesn't actually lock in until we take a rest. Well, there is also research saying, a 10 to 15 second break in learning is equally as effective. So there is this scalability, like the big change might not happen until I take a really deep rest, but all these micro changes are facilitating that big change by taking a small rest between each step. So a sustained touch might have more of a macro dosing effect, provide more information for the brain, and a small touch might be just a microdose of that same thing, and over time could really be a seed that's planted that could grow deep roots, as opposed to, theoretically, 3 minutes here one time, and then we have a moment in time and a memory we've built, but might not be highlighted as a priority for the brain if this is something that this particular client really needs to be taking time and attention to reorganize and rehabituate the way that they align their spine, for
Absolutely.
example.
Yeah.
I think a lot about um, the evidence of teaching in my garden, or maybe it's the evidence of growth. I plant a seed and it seems like nothing's happening, but there's roots that are growing before anything shows up on the surface.
Mhm.
And then once something shows up on the surface, it kind of sticks around in the same state for a while. It plateaus. You get a microgreen, you get a little seedling, and nothing happens for a while. You could stare at it for days, and then there's exponential growth suddenly.
Mhm.
It spurts into a new stage, and then it waits there. And sometimes it waits there for the just right conditions. And one big day of sun and one big day of rain, we suddenly have a giant thing. It's not growing incrementally every day. There are stages, there are plateaus, there are things that are happening underneath that we can't see in front of us. So there's always something happening, but it allows for spaciousness in the process, and a non-aggressive approach to reaching goals.
Mhm.
Goals are processes over time, and who knows, the symptom might be the head, and this might put the head in the right place, but maybe the cause is around the sternum or a thoracic spine or in the lumbar or in the hip or in the foot. Like it takes a bigger investigation to know if we're chasing a symptom around or getting to the deep root of the cause. And so this is one of the reasons why I had to leave academic teaching, because I couldn't feel like I was honoring my students and an organic way of learning, while also saying, in one more month, you've got to have these 6 songs ready and you've got to have them sung like this, and all these linear goals that don't actually reflect organic learning.
Right.
It's really imposed as far as I see it.
Yeah. There's again, this is more touch based, but there's a study that I really am fond of, 2019 by Nelson Roy, speech pathologist out of the University of Utah, I believe. Um, they took a woman, a patient with muscle tension dysphonia, and they slid her in an MRI, and they had her read a script. And what they were watching on the MRI was a very typical dysregulated brain activity that's common with muscle tension dysphonia. They recognize what's a normal brain activation pattern, and with muscle tension dysphonia, it's a very different pattern. They pulled her out of the MRI. They did the equivalent of a session of circumlaryngeal treatment, right? Laryngeal manipulation, which to me is a more aggressive form of tissue work down here, right? The thought that we're breaking the tone, breaking the tension, and then reposturing the larynx lower, and then having the patient begin to speak with coaching back and forth. If withholding the tension downward, the patient can begin to bring a more normal voice in, they'll begin to taper the pressures away to see if they can hold it, right? I mean, in a nutshell, that's sort of the laryngeal manipulation typical model. Well, after X number of minutes, she was able to pull in a more normal voice. So they put her back in the MRI and they had her read the same script. And what they witnessed was a dramatic change in brain pattern within that. Essentially, let's just call it an hour time. I don't remember the exact hour. So that she went from dysregulated to a more regulated brain activity, right? So are those neuroplastic changes? You certainly could probably put, lump them into that. The rest piece was probably included in there. I don't think they talked about that, but I think a lot of it comes from an inner awareness of, oh, I can do this, and you're teaching me how to do this, and now I can hold it on my own, right? And what I like about that study is the conclusion is it's not here, it's here. That's not what they're talking about. But to me, that's the beauty of what we're talking about. What I'm talking about a lot in my work is it's not just about what we're doing here, it's how we're informing this, and you're becoming a driver of change, right? And whether it's touch based, non-touch based, the metaphors of the garden are just absolutely brilliant metaphors for them to see that, frustration can come in, growth can come in, all of those things. Um,
Mhm.
I think, initially from the rather third-party voice of Facebook, how we've conversed in the past, and maybe I've, kind of taken unfair shots at your fascial following. I think once we can get to this sort of discussion and realize that the common grounds are really, to use your metaphor, well rooted, that it's almost like you and I, like a lot of us, we're trying to translate the exact same concepts from different languages, right? Does this patient sort of like get along with the language I'm speaking? If not, maybe I need to modify it. Maybe you need to modify it to reach this person without being condescending or dismissive, or unhelpful, right? I think the metaphors are just brilliant ways often to touch that person, not to touch physically, but yeah, yeah,
Yeah, exactly. To communicate. And I think that's, it's funny listening to you unpack that research, which you concluded it's neural that's changing. And, and I'm sitting here going, it's so fascinating how it's a communication.
yeah, yeah,
That above, so below, once
yeah.
again. But there is this communication network between, and I don't just mean a fossil communication network,
No,
but
no, yeah.
mind and body. And I often feel like we're trying to muscle the mind into the matter
Mhm.
instead of like having an experience with the matter that informs the mind, like that experiment,
Yeah.
right? That there was something in here that was showing the brain, showing the mind, both something different, something useful, something helpful towards an intention. I would be curious about retention. What was it like the next day? What was it like 6 months later?
I would have to go back to the study, Jeremy, and I can send it to you if you're interested, because I do not remember any long term. I think the paper itself was not just about what happened with this. It was also many of with known psychiatric and psychological influencers or predictors of muscle tension dysphonia. They're also looking a lot at those behavioral and psychiatric, sort of landmarks, et cetera. It's a paper that reaches a lot more than just the piece that I shared.
Cool.
Yeah, because long-term change is what we need, what we seek. Short-term are often attainable, but in my field, it's known that manual therapy has short-term analgesic effects, right? But so does movement, so does exercise, often have proven short-term analgesic effect if we're talking pain. How do you leverage that into long-term? That's the tricky piece, right? The new,
Right.
to me, the new research with touch is not saying it's not about here, but it's often about these are signalers to the central mechanisms, right? We're using peripheral stimulation, whether it's touch or awareness, right? Movement to have a more central effect on the great processor up there.
Oh, right. And there was we both saw Gil Headley last summer at different cities, and there was something that he said. I don't know if he said it when you saw him, that stayed with me. And it's a funny thing because he had a preference for one over the other, and I don't remember what it is. And I'm kind of glad I don't remember what it is. And when I was working with Gil a few months back, I asked him, and he said, "Oh, I don't remember. He's just talking." But he said, "Are we an embodied brain or an embrained body?" And I love the riddle. I just love thinking about like, is this hand interlacing with this hand or is this hand interlacing with this hand? Yes, it's both. And it's wonderful to be able to see from both angles. And this is what I mean by a bigger picture. If I'm always thinking body into brain, never brain into body, I'm missing something. I'm missing the wholeness. and I am guilty of the thing that I am trying to help others move away from, which is reducing the body into parts and pieces. It's fascinating to learn about fascia. It's fascinating to learn about where muscles live, how fascia is, where it is and how it is, and the body and by its integrity and the brain. Great. But we are alive, and we are living our lives, and we are living our lives with behaviors, and some of those behaviors are in the way of us living our lives freely. And so how do we evolve behaviors? We have a lot of evidence of that from our childhood. We have a lot of negative experiences of that in educational environments, academia. I don't want to blame academia for everything, but like in rigorous, prescriptive environments where there is a more right than a wrong, there isn't an openness to a natural, organic way of exploring as a method of learning. And so, how do we let the body be the body with a brain, an embrained body, an embodied brain? How do we just let this be one thing and work with it? How does it respond? What does it respond to? What is it like? And I think I definitely lean more to body, though I learn about brain, as opposed to some of my colleagues that are more neuro in their approach, because the body seems like a really simple feedback tool. The brain seems really, really complicated. But the body says, I don't like that. Oh, I like that better. Oh, I like that even better. Yeah. Right? Telling me, it's giving me information, and that information is really, really useful.
Yeah. And I could actually see that in almost the opposite perspective, that preferential input that we give to a body, whether it's touch or just movement, right, is modulated by the nerve, by the brain. And there, embodied. I don't remember the exact way you posed that from Gil, but I don't recall that specific one. But there was one factoid that remains strongly with me that jived a lot with how I see some of the problem with anatomical learning as it's often placed. Now, I know a lot about normal inherent asymmetries of the normal human being when it comes to skeletal muscle arrangement. But what I really liked about what Gil said was that every body he dissects, the nervous system is different, right? The location of a nerve, something as fundamental that is often very different from one body to the next, where it goes under a muscle in this body and over a body in that one. But yet our educational model, whether it's the nerve or the bones or the muscle or whatever, is all sort of this idealized image. We open Gray's Anatomy and we see an idealized image of where all this structure lies, but then the body on your table or the body in front of you through Zoom is quite different. I love that, I guess it was an admission of the uniqueness of the individual rather than how a lot of clinicians, especially in my field, they want to learn, okay, what's the anatomy? Well, the anatomy is important, but is the masseter muscle by itself driving all of this in and of itself without any oversight from other factors? The brain, the past, the circumstances, right? And that was one of my favorite take homes from Gil's talk, which I enjoyed immensely, was that the individuality, the uniqueness, which just fed into my uncertainty love. All right, that's what it was about for me.
It's such a groovy thing. It's such a groovy thing, what the body is and how unique they are. And you bring up a massively important point that the majority of images we have of the body or that we rely on are drawn. They're made by artists, meant to represent, like you said, like this average body that doesn't exist. There is no average body. We are all unique. We have muscles. Some of us don't have them. We all have our unique physiology. And I had a mentor who had 4 organic deformations in their larynx but could sing like a bird. I'd never seen a larynx like this. Wackadoodle. They found their own strategies to sing in all the ways they wanted to sing. They're using their body in the way that they're using their body for an outcome that we're going to go and objectify and say, oh, it's because of this muscle that you're doing that. Which is like, I don't know. I just can't put my faith into that kind of I don't want to say anything, but
because it's almost like you're picking a metaphor model that sounds like it's the accurate model, but in reality, it's just another metaphor. It's just another rabbit hole that we explain things from.
And it mechanizes, which to me is a real danger to the mental model, because if I want to be able to move comfortably in my voice, in my body, to learn about things in my body that start somewhere, end somewhere else, that are pulleys, that are levers, and I'm going to go and imagine myself in this way. How is that going to nurture the roundness and the connectivity that might be a truer model in my own self and also align with my experience in life? I always use this example. If you were to find out what muscles you use in your legs to walk, when you use them, how much you use them, and then you told your body, we're going to make our walking better today. All right, body, go use the quad now go to the calf, now to the quad, now to the hams, and start to micromanage our walking, we would not look better for it. We would not improve the condition of our walking from mechanizing it, even though our intention for that is precision, is betterment. But we aren't mechanical in that way. We are like this fully orchestrated, exquisite thing that moves in functional unity. And I think that's what we're looking to restore. So if we want to restore functional unity where I feel comfortable in my body to move, then how am I going to do that by breaking it down into smaller parts that is artificial?
Yeah. And I mean, that's my training right there. Not to say, to break it down in the steps like you do, to think quad, hamstring, fire, fire, but excuse me, traditional physical therapy education is a very mechanistic model. That muscle's weak. That's why you're having all these problems in life. Let's isolate that muscle and strengthen it. Now, I'm not saying it can't be effective, much as, some of those other more reductionist ways of working with voice, working with posture, all those things, right? But I think that there's an elevation and an acknowledgement of the complexity of the human. If we can say, okay, that hamstring does play a role, but the part that it plays is in the whole, not as an isolated entity. And I think again, I think we're just, instead of ships crossing, like I said earlier, I think we're actually just we're kind of going in the same direction up escalators, just again, just these different wheels turning and how we envision it. And 10 years from now, I might be spouting a whole different line of mechanism, much as we learn, right? Which I think is pretty darn cool. Instead of being stuck only in one mindset. And I think and I'm going to kind of go back to where we started all this, at least among the community that I was a part of, everything, every new piece of evidence is picked to prove that it's the fascia versus seeing that's so reductionist in and of itself, even though they claim to be non-reductionist, right? Which is, I never could wrap my head around that. And I don't despise, fascial people or fascial, narratives. I just see, let's just keep opening it. Let's keep opening it to more of some of the possibilities that you and I talked about, as well as, my gosh, you go on the internet, and you see all these different classes that people are offering. And it's like, gosh, I never thought of it from that perspective. I was just doing a podcast the other night with some myofunctional folks, right? Who myofunctional is a intervention for airway, for tongue resting posture, for a lot of different reasons, often working with frenectomies to open up the tongue. But we were talking about the different views of posture, and the interviewer, who was a myofunctional trained therapist, said, yeah, with a tongue tie, the head is forced forward so you can have the function you need. And this particular mindset is they're viewing that as the cause of forward head. And it's like, wow, that's a story I've never heard before, even though I've heard, hundreds of stories on forward head. To me, they're not right. They're not wrong. I'm not right and wrong. We're all right. Let's just work to be less wrong by understanding the complexities.
Yeah, yeah, 100%. And like, if there is one motivation that I have for trying to blow open the fact, well, this is it. The fact that we have fascia in the voice community is just that, is that we have been thinking of a musculoskeletal system,
Mhm.
and that it's bigger than that,
Mhm.
and that knowing that it's bigger than that and is intertwined with this non-Newtonian goo that holds it all together and separates it into distinctions, or however you want to explain it, it just changes the way we could work with the body. That it's not just muscles and bones, but that there's something else that we can work with, and here's something else to think about, so you can see yourself a little bit more fully. You can work with yourself in a little bit of a different way.
Yeah.
It's yeah, it's that there's something bigger that we haven't considered that can fill in the gaps, literally and figuratively.
Yeah.
And there was a fascinating moment I had in, I did a 5-day cadaver dissection a couple years ago in Ohio with a lot of the biotensegrity thought leaders like Sharkey and Avison, and Neil Thies was there. It was just fantastic. And one of the bodies that I was working with, we found a pacemaker. And so there's this metal, steel, aluminum, whatever it is, thing in the body. And the way that the body grew fascia around this inanimate thing within it was like no other fascia in the body. It was almost like silly putty. It had a different quality, a different color. It had a whole different kind of characteristic because of the way that it was interacting with something foreign. And it was just so like humbling to know how brilliant all this stuff is, how it works with the things we put in it, how it engages, how it is affected by it. Just the first time I saw Strolling Under the Skin, the documentary by Jean-Claude Barteau, I went, that is so alien. All those strings of snotty goo, and I was like, that is alien. And then I was like, wait a minute, no, that is so not alien. That is 100% me. That is 100% human, but it's so different than the images that have filled my mind about what I am.
Mm-hmm.
And that was such an interesting reflection on how far I feel from myself when I look at aspects of human form and go, that's from another planet.
Yeah, but that's us.
Right.
Yeah, very cool.
Right.
Yeah.
Yeah.
Well, Jeremy, thank you for the time we had together this morning. It's always I really enjoy work, meeting people who can, well, we can sit around and discuss our differences as well as celebrate the similarities, right? Yet from that separation of the differences, you really see that there's not so much distance between them, right?
Right. The intention is to help, right? And
Yeah.
we do the best we know how to do. But this kind of discourse, I just find very, very enriching.
Yeah.
You know, let's poke hole, find what still stands.
Yeah. Yeah. Very cool. All right. Thanks
Thanks,
so much.
Walt.
Thanks.